this is excellent news. It is really excellent news for that mother who has, you can imagine having a newborn baby, and then they're facing this disease that could kill them. The new drug by Novartis is very important for Africa's fight against malaria. Like you mentioned, Africa bears the huge brunt of malaria infections, and countries like Uganda, for example, where I live, have a really high rate of malaria deaths still, and infections. So, when you look at the last World Malaria Report, for example, in Uganda, we had over 16,000 deaths still happening from malaria, and malaria remains the number one killer of children under the age of 5. So when you consider this, and then also realize that there's not been a drug that has actually been rated for treatment of babies under 5 kilograms. We didn't have one. And, so this is something that doctors were struggling with, because treating babies under the age of 5, but only having doses not under the age of 5, but under 5 kilograms, but only having doses available for children over 5 kilograms meant that you're risking increased toxicity when you're treating these children. And it was really a challenge. So this is excellent news. It is really excellent news for that mother who has, you can imagine having a newborn baby, and then they're facing this disease that could kill them, and there isn't even a proper dosage of medication for them. It is one of those things that has been really heartbreaking. So I, for one, very excited about this news, both as a mother, but also as a scientist and as a researcher. It's amazing that this is what people have been putting effort into, and clearly we are making ground. So yeah, this is really, really, it's been great news. I think it would. So it has been approved by Swissmedic, and the hope is that it will be able to get some rapid approvals under the marketing authorization. And since Uganda was one of the countries that participated in the assessment, for example, along with some of the other really high burden countries in Africa, the need is definitely there. And now there's a product. So we do think that if it is approved, definitely it will be used. So it could have some real impact for children in that demographic in the near future. In most of the African countries, we've had at least the high burden. If you look at Uganda, for example, there is an established framework a little bit for malaria medication and testing. In most cases, you will find that thanks to organizations like the Global Fund that do fund a lot of the control tools, but also medication and rapid tests, you get a lot of medication available even at the lower level healthcare centers, which are closer to the communities. So this drug could be integrated into that system, so that even in the more remote communities, you have this medication available and testing available. Another key thing that has worked well in Uganda are what we call the village health teams. This, again, has been largely funded by the Global Fund, but these are people within communities that are trained to diagnose and treat malaria. So in this case, it is possible to still have them involved in this, even if it is just a case of sensitization, so that they have the information that they can pass on to their community, so that people know that this is available and this can be used. Yes, so I think that would be some easily integratable ways to get this medication in circulation. It has at least been very well established that malaria is going to require multiple tools for elimination. The studies have shown that. And just like nets or spraying are one of those tools of vaccination, so also drugs have a place in that toolbox. And in this case, one of the gaps that that Novartis has been able to fill is that gap of treatment for children under the age of 5 kilograms. However, this does still remain a drug intervention. And all those interventions have had certain challenges, like resistance. So there has been resistance to medications, including Coartem. Actually, it has some developing resistance in some countries, though it is still functioning. But also you've got resistance to insecticides. So what Malaria is trying to do is to also fill a gap. And that gap is what happens if you're not under net, if you're outside? What happens if the mosquitoes in your area are resistant to insecticides? Or if the malaria you have is resistant to a drug, then we still can't get to elimination. So Target Malaria is working on developing genetically modified mosquitoes with gene drive to reduce the populations of malaria spreading mosquitoes in the wild. That way, if you're not under net, or if there's resistance, or if there's drug resistance, at least there's less vectors available to spread malaria. And that means that if we can use drugs like Coartem baby and Coartem and treat people who have malaria, but we're also preventing the spread of malaria to more people, then we can hopefully together reach malaria elimination. There's a couple of gaps I would add to that. The first would be funding, because one of the things that has really challenged malaria elimination is just funding. We've had, with the existing methods, the funding gap was like 4 billion or something like that, US dollars, in spite of the billions already going in, which is what really highlighted the need for new tools, something that would be maybe more cost effective or more sustainable. But the truth is, even with new tools, you need some funding, and you need the old tools to continue working, because they are basically saving millions of lives. But money is a real factor. So there's going to be need for quite a level of dedication to really tackling the malaria problem, because it has been proven that it can be done. Look at what happened with COVID. It was a disaster, but because it affected everybody, the world rallied, and today it's not really an issue as such anymore. So this can be done, but it will require a lot of commitment, and some of that commitment is going to have to be in the form of funding. The second thing is education. There's a bit of a need to make sure that there is a lot of education at a community level, and mobilization. Because now, for example, we have the new vaccines coming in, which is excellent, but we also have this new drug that has been approved for use in babies. But if people are not educated to this, if they're not sensitized, then there is a real risk that they will not embrace something that could literally save lives. So we need to remember to not ignore the need for community sensitization and mobilization, especially for these methods that require community involvement to use. So that is a couple of the extra gaps that I would say would need to be filled for the use of malaria control tools, even new tools. So it is that not 70% of children, but 70% of malaria deaths are children, like over 70% of malaria deaths are children. So this will have quite an impact, because among that percentage of children, you could have between 3 to 18% are children under 5 kilograms. So malaria is a treatable disease, but if you do not have a treatment, then it can be a death sentence, especially for children that young. So if we have a medication that can treat those children, then at least we expect to see reduced mortality in that age, in that weight group. So and that is always something that is very welcome. But we have to keep in mind that this is a time to accelerate the fight against malaria, because it's always a fight against the parasite. There's been numerous mutations, which is why we've gone through so many different medications, even for the approved age groups. So now we have one that can treat it in this age group, and we need to work as hard as possible to make sure we can beat malaria before there's resistance in that age group. That is the point. We have the tools, but we need to use them with everything we've got, develop everything we need to fill in whatever gaps we have. Genetically modified mosquitoes is one way. There's new generations vaccines being worked on. So basically what I'm trying to say is this is a very important step in the fight against malaria. But there is more to go. We cannot relax now and say, oh, we're done. But we need to make the most of this progress and make sure we can't go backwards.